Good morning, all. Am I audible? Great. Good morning. We're starting our reading club with a prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning, all. We are giving tribute to our great master, Dr. Samuel Hahnemann, for this divine science and taught us dare to be wise. We are seeking blessings from our Guru, Dr. Prafull Vijayakar, sirs, who have made this divine science and modern science the easy homeopathy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijay Karaya Namaha. Friends, we are in the journey of reading practical part of the organon of medicines, Samuel Hahnemann, and the fourth book of Dr. Vijay Sir's, the Verbatim, the workshop conducted in 2002 at Mahabaleshwar. So we are continuing with the organon. So up till now, we have understood the knowledge of the disease, the knowledge of the chronic miasm, and the case-taking part. Now we are in the journey of understanding how the medicine has been. So, aphorism number 109, what Master has said that I was the first that opened up this path. That path was something that is I started the proving medicines on the healthy human being. So Hahnemann was the first. Before that, there is one author who proposed that, but nobody understood that. But Hahnemann took up this challenge and he started proving on himself and then on the fans and family members. So I was the first that opened up this path, which I have pursued with a perseverance that could only arise and be kept up by a perfect convictions of the great truth, fraught with such blessings to the humanity, that it is only by homeopathic employment of the medicines that the certain cure of the human malady is possible. So this is what he wanted, that I have started the proving of medicine so that we can understand the pathogenetic power of the medicines. And when we know the exact pathogenetic power of the medicine, when we apply this to the healthy body, and then when the diseased person is coming to us, the same principle of similia to be applied on that, and then the cure of the human malady is possible. So what footnote 92 says, it is impossible that there can be another true best method of curing dynamic disease. Means all disease not strictly surgical. Beside homeopathy, so he said that homeopathy is the best. Just as it is impossible to draw more than one straight line between two given points. So homeopathy is like a straight. He who imagined that there are other modes of the curing disease beside it could not have appreciated homeopathy fundamentally, nor practiced it with sufficient care, nor could have he ever have seen or read cases of properly performed homeopathic cure, nor on the other hand could have discerned the baselessness of all allopathic modes of the treating disease and their bad or even dreadful effect. If with such lax indifference he places the only true healing art on an equality with those hurtful methods of the treatment, or alleges the latter to be auxiliary to the homeopathy, which it could not do without. So this is what something that's why all are doing that homeopathy is the second line of treatment, but it is not like that. My true conscientious follower, the pro homeopathist, with their successful, almost never failing treatment, might teach these persons better. And that is what the path is taken by one, Dr. Vijayakar sir, and who follow this and taught us that homeopathy is the first line of the treatment, not the second line of the treatment. The first fruit of this labor, that means the drug proving, as perfect as they could be at that time, I recorded in the Fragmenta de Vivus Medicamentorum Positive, Sivin Sano Corporo Humano Observatis in Leipzig 1805. The more mature fruits in rainy. So this was the writings of Dr. Hahnemann's in 1833, 1825, 1825, 1826, 1827, and English translation of this is in the form of Materia Medica Pura, Volume 1 and Volume 2. And in the second and third part of the Dichronicin Truncating, that means chronic disease, in 1828 and 1830. So this is the second edition with the fifth part. So everything what Master has found in the healthy human being, it has been recorded in this all the datas and books. So whenever you are treating something with the patients and you get the result, retrospect study this in the olden books of Master Hahnemann's and the Herring Guiding Symptoms so that you can get the idea that why this medicine works wonderfully in this case, because this is what the pure effect of that medicine is there, and that is why the reason it works in the very dreaded conditions of the patient. So this is what you have to learn. So we are continuing the series of learning on the book Verbatim, the workshop conducted by Dr. Prafull Vijayakar sir at Mahabadeshwar in 2002. We are reading this. So up till now in this book we have read many things that okay, first. So We have understood the approach of many disease. We have understood the miasm. We have understood the knowledge of the disease. We have understood the particular one-sided disease, the psychiatric disease, autism, the approach of everything. Now, today we are starting with the approach of pediatrics. So this is was beautifully given by Dr. Praveen Jain. Again, he is one of the predictive panel doctors working along with Dr. Prafull Vijayakar, sir. So what he taught us, chapter 19, Dr. Praveen Jain. So my topic today is on the pediatrics. When I started my practice, there were two major problems that I faced. One was acute cases, where Dr. Vijayakar has helped me a lot, and the second was a pediatric cases. If a 6 month old baby would come to me for the first time, I would get scared. Someone told me to take the mother's history during pregnancy, so I used to keep the child out, as child also used to disturb me. I would take a long history of the mother and then prescribe. Then I said, no, I have to understand this aspect also. Very few homeopaths have written about this topic. The major chunk of my practice, 40 to 55%, is the pediatrics. I owe this complete lecture to my daughter. She is 3 years old. I was observing my daughter's development, and this is how I started getting up a grip and understanding some finer aspect of pediatric case taking. So I would like to start with the cases. So the case is like that. 1.5 years old male patient came with the chief complaint of the wheezing since 4 months. He gets a recurrent URTI every 1 and 2 weeks. He was full-term normal delivery and all vaccinations were given. All his milestones were normal until 9 months of the age, after which walking was little delayed at 12 months of age. This is very important. One must understand what is normal in the baby and in the pediatric. The disease usually belongs to the first and the second layer of the disease. So most of time, whenever you are treating the pediatric patient, you will get the disease of the first and the second layer only. So past history, the past history in that the insect bite and allergy with some secondary infections on the May 2000 was admitted 2 to 3 times for this recurrent diarrhea and UTI at the age of 1 year. He had knee pain 2 months back, first right-sided and now left, and sorry, and history of the elbow dislocations few days back. So, mother history in pregnancy, no complaint during pregnancy. She was a priming. She had a slight mental tension during the pregnancy. Does not feel appreciated in her in-laws' place. In-laws are very orthodox, and she could not adjust there. So this was the common story to all the female, and no other significant history. So we cannot get anything from this. So it was in 2002. Now, nature of the child, he runs around in the house, never sit at one place, very restless. He is very cheerful and loves music a lot. Put everything in mouth. Uh, when he does not get what he wants, he gets angry and shrieks in the anger. Desire to be carried plus plus and desire constant attentions plus plus. Love to be praised. Wakes up often for a breastfeeding at night, physically hot, thirstless, and perspirations over the scalp. Now, on the basis of what could be the medicine you can think of? So this was the history. Hot, thirstless, put everything in the mouth, cheerful, restless child. Uh, he got very angry, wants everything, so obstinate, shakes in the anger. Think of tarantula, very good. Desire to be carried, breastfeeding at night. Okay, so first term things, the sir has prescribed something which is PQRS, that is a shrieks in anger. That means emotion has been exaggerated. The shrieks in the anger is the PQRS taken at that time. So shrieking in anger plus desire to be carried always. So on the basis of the remedy given was chamomilla. Now let us see the follow-up. So in the follow-up, no asthma since 3 days, 10 days, cough better, cold better, appetite is okay, placebo was prescribed, perspirations over the scalp, slight loose motions, greenish in color, cough better and cold, again the same cycle. Then in 2 months of the span, he got a severe attack of asthma and wheezing. Again, the second dose of chamomilla was given. Then he developed pain in the leg, excessive crying at night, referred the child to the pediatrician who prescribed that this is the growing pain. So he prescribed the calciums and vitamins. So again, the SL was prescribed. Pain better, but frequency is plus. He now passes stool after food, occasional cough and cold. And after the 2 months again, severe right knee pain of a sudden onset. There is episode in 1 week, no history of trauma, and again refer to the pediatric pathology. So in April 2001, this child was referred to the pediatric orthopedics and investigation were done. His X-ray shows the moving of lower end of the femur and upper end of the tibia, prominence of the epiphysis, and the increased height of the growth plate. The serum iron phosphate was 1460. Calcium and inorganic phosphorus was normal. So this is suggestive of some disease, that is a deficiency disease, and the impression is of a gross rickets. So child should be investigated for the cause of metabolic abnormality, as the patient was already on the calcium since 2 months. So it is a gross rickets. So how the child is presented to us with the recurrent cold and cough, and after the prescriptions of a remedy, this child goes into a structural changes and a gross rickets. So reconsidering the case that this was not the right prescription. So again, we are starting with the journey of the disease. It was the whole term normal delivery in 1999 with a 2.84 kg weights, oral polio and the hepatitis B vaccine was given. Then admitted with the complaint of the poor weight gain, given once blood transfusions, UTI once, loose motions with the blood stain, loose motions off and on since 2 months, then insect bite allergy with the secondary infections, and then wheezing, bronchitis, knee pain, diagnosed as a cross rickets, and the elbow dislocation prior to this. So we know that the child had come up to us with the ectodermal or endodermal disease, and now we have pushed the child up to third or fifth layer or the metabolic abnormalities. So I was asked questions in Hyderabad, does disease travel step by step, layer by layer, or can jump also? So this was the question by one of the delegates in Hyderabad. So what Dr. Praveen Jain's observation is that if you go to an allopath, the disease has to travel step by step. Their side effects are very systematic. With homeopathy, it can jump anywhere. He was traveling slowly from first to the second layer. Partial similar homeopathic medicines are the most dangerous and the fastest suppressor. So this is what his experience telling us. So I review the case again. So on the again reviewing the case, the disposition of the child is most important. The child is very, very mischievous. He does not sit at one place in the house. He is very restless and stubborn. Must get whatever he wants. He is not affected by anyone's scoldings. Whoever scold him, he is only slightly scared of his father. If scolded intensely, he will keep quiet and change the topic and divert your attention somewhere. Very attention seekers knows how to get his work done by any persons. If you hit him, he will hit back to some people, especially his granny, or just keep quiet. He pinches if not allowed to take some things. He rhymes words which he can repeat, imitate advertisement, imitate father, very fancies about the cars, wants and has different types of cars, loves to show off, shows everyone everything new that he has, wants to wear father's clothes. If he does not want to wear a particular dress, he will try to reason out and say that father will scold me if I wear this dress. So how intelligence is. He start laughing loudly if he sees mother and father changing their clothes. possessive. He does not give his toys immediately to others. He knows directions well when they go out. He wants father to carry him so that he can see everything clearly. Loves traveling, gets restless in 10 to 15 minutes, and then it is difficult to control him. When father sits on a computer, he does not allow him to sing and the restlessness. Now, the video clipping observation, the child is restless, lean and thin child could easily be examined. When he realized there is a camera, he start hiding behind the table, shy and bashful. He was screaming and protruding the tongue out. The mother has to constantly hold him as he is losing control. Mischievous, the child says, I am a Popeye baby. So this is a cartoon character. I then shouted at child, so he closed his fist in anger and went to mother to bite her. So this is what he was again angry and threatening, but biting the mother. He showed his fist to me with the angry eyes. That is, the threatening had to be controlled, and he imitated the physicians. Now, in this case, the carried desire to be could be because of his bow leg or pain or from a better view. So also, bashful is not here the symptoms because it is the adaptability period. So this is what very important understanding that how the child is presenting to you. If the child is adapted within 5-10 minutes, then the few symptoms loses their value. So whenever he saw the camera and he becomes shy and bashful, but he is so much so restless. So here the bashful loses the value because it is the adaptability period. The children need time to get adapted to any new stimuli. So very important that you have to keep in mind that whenever the children comes to your clinic, you should think this, how he adapted and how he behaved during the consultation. If throughout the interview child goes behind the mother, then it is the shyness. So many a time you find that the child comes and they goes behind the mother. They goes behind the mother. So that is the shyness. This was the only during the adaptation period. Every day there are new stimuli and the child gets adapted. So observe the child after this adaptation period. So most of time when the child adapted. So sir always says whenever the legacy patient comes to your clinic, so initially he was very fearful and scared, and he come from behind the mothers. So you feel that he is a very timid and bashful and insecure fellow, and sitting very quietly and very timid. But once he know that doctor is not harming, and then the color of that ophidia child is increasing, and he started talking and started laughing, and then he feels that everything this territory is good for me. So this is something you have to observe. So before adaptation, the picture is different, and after adaptation, the picture is different. So that is what you have to keep in mind. Observe the child after this adaptations period. So he is intelligent and observant as he was the only child who immediately recognized the camera. Not all children notice it. Do not restrict the child during the interview. They will give you the remedy. So most of time, mother father says that beja chup. So whenever they are doing like this, allow them. Okay, so that you will get the exact observation of the child and you will get the idea what child is. So that gives you a remedy. So after that, the analysis, the mentally he is a Popeye baby, the cartoon character with the increased strength throughout, though he thin, approaching, hyperactive, extroverted, very disobedient, imitate father, physician, advertisements, observant and intelligent, mischievous, cannot be restrained, screaming, shrieking, mocking, destructive, manipulative, and insanity with increased strength. So this is what something that the higher version makes the gestures physically lean, thin, hot, and thirstless. So on the basis of this dispositions, the disposition was taken as the hyperactive plus disobedient plus threatening plus destructive. So four remedy comes into play, that is the tarantula, stramonium, and tuberculum. Three remedies. So in hot remedy there is a tarantula and tuberculum. Now the tuberculinum is thirsty and not very mischievous. It is not given in the rubric mischievous. and not destructive like the tarantula. Even destructive tuberculin is destructive, and the symptoms of tuberculin is anti-parenting. So they always against the parents. There are three remedies are there: tarantula, tuberculin, and one more remedy is there in anti-parenting against the parents. The remedy given was Tarantula hispanica, rightly said by two doctors in our group also, that is a Tarantula. So follow within 1 month, the serum alkaline phosphate was reduced from 1400 to the 542. The moving has reduced. There is a mild irregularity and scoliosis at the lower end of the femur and upper end of the tibia. This is irregularity of the inferior aspect of the femoral epiphysis. As compared to the previous X-ray, there is a marked improvement. So X-ray shows that X-ray findings are in favor of healing rickets. Again, the further follow-up serum alphos was normal. So this is suggestive that how a wrong medicine can land up with the progression of the disease, and when we prescribe the right medicine, immediately the patient came back to the state of cure. So what was the challenging things we have to understood in the pediatric case taking. So the challenging task, the pediatric history taking is one of the most difficult tasks for homeopathic physicians. The main aspect of the pediatric case taking is dependent on the observation. So I must advise all should keep watching observations, keep watching videos. So in the video also you can observe. So most of time Insta reel that will give you a many idea that how the person is behaving in front of you. So cultivate the habit of observation. Here, a lot of direct questions is required, mostly in pediatric cases. There cannot be any standard pattern of the history taking, as the questioning will change depending upon the age group we are dealing with. So many a time the children comes to you, so a very infant, then the toddler, then the school or school going children. So in that same way, you cannot uh, have an idea that every time you can ask the same question to everyone. So the question is also changed, and history taking pattern also changed. The birth weight of the child will be double in the first year. So for that, you all need to understand how the normal development of the child. So there is a normal development of the weight, normal development of the height. There is a teething process. So many a time, if you know that this is the normal and this is abnormal, then and then you can have the idea that you have to prescribe the remedies. So there is a rate of growth is so fast that the questioning and interpretation will change at every passing of the month. So you should be very vigilant and you should be very well versed in the process of development of the normal child. So, however, if you understand the normal child and is fully aware of the development of the newborn to the infant to the toddler, the case taking become very simple. So, for example, development to understand what is normal child, we have to understand the development of the child, and it is divided into four stages: the infant, the toddler, the preschool, and the school age. So, what we call as infant, it is 0 to 1 year or 1.5 years, we can call it as the infant. Then 1 to 3 years, it is the toddler. The preschool, 3 to 5 years, and the school years. After the 5 years, we can have a school age. The observation and interpretations are different in these age groups. The case taking should also differ in this age group. Again, the developmental process, we have to understand the mind of the person, that means the dispositions or the temperament of the person. So here what Dr. Praveen Jain says, it is a temperament. The temperament is defined as the individual's normal, natural style of behavior and responding to the world. So that is what how he adapted this to the situations. So this is what the temperament is. So it refer to the how and not is what of behavior. So this is what how he adapted. That is the important aspect. This means temperament does not dictate what children will do, but help understand how they do it. So temperament consists of the trait you are born with. It differs from the personality, which is combinations of the temperament, nature, and the life experience, the people and the environment. That is a nurturing. So many a time you can have the idea that how adaptation start. So nature is different, and certain life experience make them to be a different. So this is what something that is you have to understand. As a homeopath, we are supposed to understand the temperament of the child. The temperament is determined by your unique neurological characteristic, and unlike personality, it cannot be changed. It remains moderately stable across the time and situation. So here we can understand that what physical stories say that the innate characteristic, the non-disease characteristic has to be put into temperament. That is a basic trait, how they adapt to the environment with their basic quality. So that is the trait which he came from the genes. And the personality, that is what the change. So we all know that personality developmental classes. So previously he was very timid, and after taking the personality developmental classes, and they become very confident, and he can speak on the stage and everything. So everything has been changed. That is what we call as a psychosis. So be like that. Many a time the children is put into some of the classes, that is Aloha classes or Vedic maths classes, and then they learn something and they adapt that. So that is what something that is a change. So you have to understand that it is the characteristic. So, how to approach the pediatric cases? So, in understanding the pediatric cases, we have to understand this temperament or the dispositions or the innate characteristics of child. We have to understand the axis, and that axis is called as the sociability, activity, destructibility axis. That is called as SAD axis, proposed by Dr. Praveen Jain. To this, when we add the thermal and thirst and a certain characteristic mental symptoms, we arrive at the similitude. So this is what how Dr. Vijayakar sir has made the theory of acute, in which he made that the activity thermal thirst axis. This is what Dr. Praveen Jain has made the mental axis, that is called sociability, activity, destructibility axis. And if you apply thermal thrust to a certain characteristic of the mind, you will easily arrive at the simillimum. For more learning on this said axis, you can go and refer the book Essential of Pediatrics by Dr. Praveen Jain, and there is one Materia Medica, Essence of Materia Medica, Encyclopedia of Materia Medica. That is what the book is by Praveen Jain. So you will get how he had made and how the dispositions of the child is written in very easy format. So this axis will lead us to group of remedy from which we have to eliminate the remedy and arrive at the simillimum. So what is the sociability? Sociability in the children or a pediatric age group, it is a two type. It is one is the approach kind of personality, one is a withdrawal kind of what Dr. Vijayakar sir has said that some genes are the extroverted and some genes are the introverted. So this is what something same way. So what is approach and withdrawal refer to the initial response to the new situations or the stimulus. Some children moves easily into new settings, taking very little time to join a new group of playmates, while other may observe the scene for a long time before going into a new situation. So this can also be applied to the other situations, such as trying a new food or changing the daily routines. For example, some children eagerly seeks new experience while other withdraw from the new activity and experience. So this is the difference you will get from the some are approaching and some are non-approaching. So approaching child or withdrawal child. So how the approaching child behave? So infant and toddler comes to your clinic, so you have to observe that. So these are approaching child called as extroverted. They like to play with the new toys. They are curious to explore it. Will give smile to the new faces. So this is the approaching child. Will go to the new peoples or will allow you to examine. This is the approaching child. Greet you when they come in the clinic or leave the clinic. So hi doc, I had a patient. So always he comes and he doing the high five. So this is something that is the approaching child is. The withdrawal child, on the apart from this approaching child, the withdrawal child and infant is like introverted, so slower to warm up to the change. So that is what they can adapt to the situation very slowly. Will avoid the eye contact to the new faces. Will not mix with the other children and the people. Or whenever you are examining, they are crying and will not allow you to examine. So this is something called as a withdrawal of child. Or they can refuse to greet you while they are coming or leaving. So this is what something you have to keep in mind. So on the basis of this approaching and withdrawal chart, what Dr. Praveen Jain has made a chart that is a chili remedy and hot remedy. So the approaching chili remedy are phosphorus, rustox, spongia, veratrum, hyoscyamus, coffea, carcinogens, and belladonna. Whereas the hot remedy, Lachesis, Argentum nigricum, Crocus, Chamomilla, Bufo, Tarantula, Madorinum, Opium, Sulfur, Carcinogens, and Pidovin. So carcinogen can be both chili and hot. Withdrawal, introverted remedies, the chili, Baritaca, Calcarea, Calcarea silicata, Entim, Entim crude, arsenic, aurum, China, Ignatia, Kali phos, mercury, natrum carb, nitric acid, sepia silica, staph, and stramonium. And the hot remedies are the ambra, bryonia, sina, chamomilla, gelsemium, lyco, natrum, pulsatilla, and thuja. So these are the few remedies example which was given by Dr. Praveen Jain. For more remedy understanding, I must advise all of you to refer Dr. Praveen Jain book Essentials of Pediatric, and he had given the idea how this works. The second part of this axis is the activity. So activity defined as a degree of energy expenditure throughout the movement. So it is viewed as one of the important dimensions in determining the temperament. So activity level is apparently inherited and also influenced by the child's environment. So activity level is also related to the child's gender. So boys tend to have a high motor activity than the girls. And the destructibility, it can be the reaction to the anger. So most of time the child may smash, child may rip, or child may tear apart the object or the toys, and this shows the expressions of the destructiveness. So this destructive behavior are often directed to the nearby convenient target, often the source of anger. So there can be two processes. One is a destructive and one is a non-destructive kind of personality. So non-destructive, the anger can also be manifest without motivating destructive behavior, such as in a temper tantrum marked by throwing self to the ground, screaming and writhing. So this is something that is a non-destructive and something that is destructive. Again, the activity can be assessed by the following six point, that is especially in case of pediatrics. So level of activity, threshold of responsiveness, intensity of the reactions, rhythmicity, distractibility, and attention span, and the persistence. So what is the level of activity? The ratio of the child active period in contrast to his inactive or a passive period. So that is called the active level of activity. So most of time you can ask the patient that are he is a playing child or he is sitting. So mother always saying that he is very restless. He cannot sit at one place. So his activity is so high. But some mother says that sir, he is a very quiet kind of personality. He play at one place and sitting at the same place even though 2 3 hours have lapsed. So that is what the level of activity is. So some are passive, some are inactive, and some are more active. Threshold of responsiveness, that means the sensitivity. So when the baby wakes up, they remain calm when you change the diaper. If they tumble, they just get up and start walking again. So that is what something, the threshold of sensitivity. Some are very sensitive, that they have irritability. So baby cries and scream if a little wet. So if you know that arsenic baby threshold of responsiveness is so high, sensitivity is so high. So whenever he got little weight in the diaper, he cry immediately and he wants mother to change the immediately. So that is what another aspect of fastidiousness also, and there is the sensitivity, the threshold of responsibility, responsiveness. If they tumble while learning to walk, they screams and cry with the indignation. So this is what something you can understand the responsiveness of the child. Then intensity of the reaction, is the child vocal of positive or negative reaction to the stimulus, or a calm and a quiet. So that is what you have to observe. If you just touch a child and he screams, then he is hypersensitive child. So most of time in the camp cases, I used to go to the Mumbai camp where Dr. Nishant Gandhi was dealing with the case. So he used to hold the hand of the child and you observe the how the child is reacting. So some child is taking hold of withdrawing the hand, some manipulate and slowly make the doctor to leave his hand. So this is what something you have to understand how the intensity of reactions is. And some child, that is what I had seen, that one child came with the bat, a playing bat, cricket bat, and a plastic cricket bat. And whenever the doctor hold the hand, he used to threaten the doctor, not giving hit on the doctor, but he is to threaten the doctor that I will hit you, I will hit you. And that is what the reactions of the child. So that is what the intensity of the reaction. So you have to observe a small reactions of the child when the child comes to your clinic. Then the biological rhythm. So if the regular, then the mother can predict that when will be the child is hungry, when will child has to go to the school, or when will he will go to the sleep. So if it is a regular, so the rhythm has to be most important. So in that rhythmatic conditions, you can find that the child is very diligent kind of or conscientious. If the rhythm is irregular, unpredictable, then child can be a non-conscientious, non-diligent. It can be think of, okay, but your observation has to be matched with the history. So eat at any time, they wakes up erratically or do not pass stool regularly. So the diligence means what, the consistency, regular and everything, but when it is irregular, the non-diligent kind of things. The distractibility is the child easily distracted from what is doing, so or can shut out external distractions and stay with their current activity. So that is what very important. So some have attention span is so high, so he can be work engrossed. So sometimes we can think of the absorb in the work, or some having a less attention span, so he can move around and everything. So that is what the attention is less. So you have to think that distractions is high. So if child is sleeping and you just switch on the light and he wakes up, so he is very hypersensitivity, so it is a distracted. So very important. Attention span and persistence, does the child use as soon as they have a problem with the task or keep on trying. So this is what also you have to keep in mind. What is the activity level? We have to assess whether the child's activity is more or less. So point to access activity that we called as the hyperactivity. So in infant, the kicking, the moving of the legs and the throwing of the coverings and does not remain in the hand, these are called as the hyperactive infant. Whereas the toddler, when the toddler started running, so runs here and there all the day, so that is called hyperactive. Point to access the normal activity or low activity in the infant, that means the hypoactivity, keep schools in the wrapping so he can remain in a wrap, not to move, so not to kick or sleep peacefully. So these are the things that will guide you, that when the infant comes to your 6 month infant, so you have to observe the child. So mother wrap infant into coverings, and mother says that in the morning I can make a coverings, and afternoon till afternoon he sleeps peacefully, or he is playing peacefully in that covering also. That is called a hyperactivity or low activity child. A toddler, in a toddler will sit peacefully and listen to the story, or will sit quietly and watch the TV. So that is what the things that you have to understand. So whenever you have to categorize two with the remedy, so hyperactive chili remedies are the rusto, arsenic, chamomilla, myrrh, hyos, room, stamina, suja, and many more. Whereas in hot remedy, hyperactive is the iodine, chamomilla, mercury, argentum, tarantula, medullum, sulfur, and ambra. So whenever you can think of this axis, like a short glimpse of this axis is a SAD axis, sociability, activity, destructibility axis. Whenever you find that approaching plus hyperactive plus destructive child, you can think of Tarantula, tuberculinum, chamomilla, veratrum, and madorinum. Whenever you have approaching plus hyperactive and non-destructive child, you can think of Rustrox and Argentum nitricum. This is what a few glimpse. For more understanding, you must go to the Essential of Pediatrics by Praveen Jain. Whenever you find the withdrawal child plus hyperactivity and destructivity, the remedy can be Sina, Stramonium, and Mercury. Withdrawal, hyperactive plus non-destructive, the Lycopodium and arsenic al. So we will go to read a certain remedy with a few pointers. So we will have an idea about that remedy and we can apply that remedy in case of pediatric or infant cases when they came to us. So Tarantula, the Tarantula is the dance name by the city of Tarentum. The Tarentism is a dancing mania set up in a persons bitten by the Tarantula or in those who imagine themselves bitten. The cure is the music and the dancing. The mental makeup, the sociability, activity, destructivity is the approaching, hyperactive, and destructive. So this is the three key point that approaching hyperactive and destructive. Now the point that is the abrupt, irregular in movement, whereas lachesis is rhythmic. Again, Tarantula hispanica is not so rhythmic, but Tarantula cubensis is rhythmic in their movement. So lack of control, mischievous, sensitive to music and better by the music and feigning sickness. So most of the toddler will tell you मुझे headache हो रहा है मम्मी. So that is what feigning sickness. Provided you have to investigate the child is telling right or telling lie. So if the child is telling lie, then this is a feigning sickness. The Fatak says malingering when there is no observer, there is no hysteria. When attention is directed to her. So this is what the hysterical symptoms of tarantula. General makeup, the sudden and violent onset can run better than the walk. Physical makeup, emaciated. So this is what the tarantula, the chamomilla, the sociability, activity, destructibility, the approaching hyperactive and destructive, weaning and demanding cry. Child wants to be carried, capricious, uncivil and quarrelsome, can slap to anybody. This is uncivil behavior, extremely sensitive to the pain and ailment from anger and vexations. Thirst is increased, thirsty, and the physical symptoms that is one cheek is red and hot, other is pale and cold. This is what irregular distributions of the circulations and the heat. The Sena child, the withdrawing, hyperactive, and destructive. So here the difference of the Sena and Chamomilla is approaching, whereas the Sena is withdrawing. Both having hyperactive, both are destructive. Both have irritable and cranky. The piteous cry, the cry of the Sena is the boring to your ear that keep the child away. So that is what the Sena child is. Desire to be carried over the abdomen, aversion to caress and wants to be robbed. So this is what something you have to think of. So if the Chamomilla is approaching that he wants caressing, whereas Sina does not want caressing because it is a withdrawal child. General makeup, he is very hungry, eats more than the drinks, less, thirstless, chilly. Physical makeup, boring the nose, and the obese child is. Chamonium, again, withdrawal, hyperactive and destructive. The terror and the fearful dread of darkness, clinging to those near him, goes into violence, rage, kicking and biting, or snatching the face of the father. Again, it is a stramonium, destructive, wild, and threatening. Sudden general makeup, the sudden onset of the complaint, and the thirst plus plus. Physical pupil dilated when the child is reprimanded. So this is what the fearful aspect of the very observatory symptoms. Pupil dilated when the child is reprimanded. Tuberculinum, the approaching hyperactive and destructive child, dissatisfied and restless, the desire to change, desire to travel, does not remain long in one place, violent and wants to fight, sensitive and worse from the music. General makeup, emaciated, tall, weak, and increased appetite, start suddenly and decrease suddenly. So this is what the disease pattern is: start suddenly and decrease also suddenly. Physical makeup, a long bone, nose and sharp features, desire cold drinks and the milk. This is the tuberculin. Argentum nitricum, so approaching, hyperactive and non-destructive. Argentum nitricum having anticipatory anxiety, so that may lead to the impulsiveness, always in hurry and impulse to walk fast. The children who walk very fast, they are argentum nitricum. Hot, complain increase and decrease gradually, craves for the sugars and candies, craves for sweets, which aggravates. After sweets, he developed cold and coughs and everything. So this is what something you have to keep in mind, the argentum nitricum. And the physical makeup, they are emaciated, especially of the lower lid. Mercurius, the mercury is the only metal which is liquid, so it is approaching, hyperactive and destructive. We all know that is a violent, horrid, impulsive, unstable child, desire to escape, desire to travel far away, very, very mistrustful and suspicious, defiant and disobedient child, will not listen to the parents, revolter, rebels against the polities, revolter kind of personality, precocious, dominating and dictatorial. Can fight with anybody, can hit anyone, can beat anyone. So that is what the mercury is. Mercury can be timid also in the childhood. The key point of the mercury is the excessive perspirations and salivations at the night and thirsty. The physical makeup, mercury can be obese as well as emaciated. There is one thing what Sir has written, obese and active, the two remedies are there, mercury and opium. Lycopodium, so we can think of lycopodium when the infant or children are the withdrawing kind, hyperactive and non-destructive. So they are good at outside and very dominating and very very dictatorial at the home, diligent outside and at home he become very very dominant. So sir is right that hard on inferior and soft on superior. He gets scared of the father and grandfather, but he can dominate mother and grannies and younger children. Will direct anger on the mothers. There is a stage fear, there is a domination and love for the power. So this is what lycopodium is. Generally hot, desire for the warm food and drink. So many a time mother tell that if I keep the child to give a tea or a milk, it require a warm milk. If the milk is cold, he will not take it. So that is what the things you can observe in the case of a lycopodium. Thirstlessness, physical makeup, the upper part is vested, lower part is semi-tropsical. The typical case of marasmus you can think of lycopodium. Another case, the case 2, the child came for the chest infections and some GI disturbances with the toxic look. So most of them in emergency, you can think of this. He was just discharged from the hospital after 10 days course of the antibiotic. After antibiotic, also the child looked toxic. The behavior pattern observed is changeable and capricious, wanted to go to the mother, then father, then play on the ground, and then back to the mother again. So this is what the capriciousness is. The restless, very, very playful, goes to everybody, hot and thirsty. So child was given a dose of chamomilla. Follow up after 12 hours, the crying stopped, vomiting stopped, crankiness was much better. The child was now playing on his own. Another case, a very restless child, mother has to hold the child and restrain it. The child is very active, playful, and hyperactive, sensitive to music and dance, shrieking suddenly and then cool down only after he was slept. This child was typical shrieking throughout the day. He came in humming and smiling. He broke glass in my clinic. At the end of interview, I just shouted at the child the difference between tarantula and tuberculin. You can make out here. The tarantula is very destructive and threatening, whereas tuberculin is not so destructive. So this is what very important aspect of understanding. Changeable and capriciousness as taken into considerations, and restlessness and painful on the basis of that the chamomilla was prescribed. This is a short case. So the remedy given was the tuberculinum. Now we see the last clipping. So this was the case which was shown in the video, and on the basis of that video, the some inference has been taken. So this is what I have to explain you. So in this, tuberculinum was given. Now we see the last video clipping, that is in case 4. The child aged 4 months, activity is normal to hyperactive. See the mother's hand is not trying to jump out of the mother's hand. The child is comfortable in one hand of the mother. Hyperactive, mischievous child putting finger in his mouth and sitting quietly and chilling. The child was born after LSCS and was not given to the mother for the 6 hours. There was no contact between mother and child for 6 hours. Also, after 2 months of the age, his mother joined her job and child was with the maid servant the whole day. So bondage problem, bond of the faith developed within the first few hours between the mother and the child. So what was this? The child hyperactive, approaching chilly, ailment from disappointment in love because he did not get the love from the mother. So remedy given was hyoscyamia. This is what the understanding the infant. This is what the trick given by Dr. Praveen Jain. So this is my approach. This is Dr. Praveen Jain approach. He sees whether the child is approaching or withdrawing. Then he sees whether the child is hyperactive or hypoactive. If the child is hyperactive, then I find out whether he is destructive or non-destructive and combine it with the thermal thrust and the characteristic mental symptom. So this will give you the easy understanding of the infant and the child in a short span and in a short history. So this is what a few things which we have learned from Dr. Praveen Jain. Recently, Dr. Praveen Jain will conducting a seminar in this end of March. So I will share with you approach to pediatric with the case solving webinar in 27th March of this month. So we'll share the image of that webinar in the group so you can join with them and you can learn far better. This is what the glimpse is here. For more learning, I must advise all of you to read the book Essentials of Pediatrics by Dr. Praveen Jain. And for more understanding of the Materia Medica, you can go through the Essence of Pediatric Materia Medica by Praveen Jain. So you can get the idea of how a particular remedy behave in an infant state, in the children state, in the toddler state, and everything. And there are rule in and rule out in point of certain remedies. So that will help you to understand in a better sense. Hope we will conclude our today's sessions here and we will continue this journey. At the end of this week, we will finish this book. So we will have a great learning from this book and we learn a lot of approach from this book also. So this is what the pediatric approach. Okay. So thank you so much. So we will conclude the day today. We'll share next book. We'll share in the group. Wait. So thank you so much. Thank you all for joining the Readers Club. Thank you so much.